Okay, just a few more coming in. So thank you very much, everyone, for joining us this morning. We're here to talk about how COVID testing can help your business. And we're delighted to be joined by Professor Jim McManus and also Susan Hamilton. And they're both from Public Health for the County Council, both experts in this field. So they're ready to take your questions. Just to let you know, we are recording this session because obviously it was in the middle of Easter, a bit short notice, and other people can't make it, so we're recording. There is an opportunity for you to use the chat at the bottom of your screen to put questions in as we're going along, and then we'll pick them up after both our speakers have finished. So without further ado, I'm going to hand over to Professor Jim McManus, and thank you for joining us today and coming to talk to our members.
Well, thanks, Breeze, and good morning, everybody. And actually, it's really good to be doing this because it's a sign that we're on the way to opening up again. And I think there are reasons to be hopeful. But before I kind of outline those in a few minutes, I just want to kind of make a bit of a pledge that if there's stuff you think we can do to help you as businesses, then, you know, do let our colleagues in the chamber and do let Lauren know, because we do want to help. I chair a thing called the Health Protection Board, which is a board of all the local authorities, all 11 councils plus NHS, police and a number of others. And it's our job to produce an outbreak plan and to kind of try and steer us through. And we just come from a fairly hefty lockdown, and we're moving along the Prime Minister's roadmap towards full reopening and ease of restrictions. And although it's volatile, and although it's going to be a bit of a bumpy ride because we expect the numbers to go up as every step of the roadmap comes. We've just had step one, our numbers have gone up a bit, but not as much as we feared. Step two comes on the 12th of April on Monday. We know that numbers may go up, but they don't have to surge. We don't have to make the mistakes we all made last year when we kind of took our guard off a bit and the numbers surged too much. We can keep the numbers low. And I think the key task for us in Hertfordshire as we go forward is to find a way of trading, working, living and studying safely while the virus is endemic for now. What we know is that this virus isn't going away anytime soon, but we know that the vaccine has made a massive difference in terms of the number of people admitted to hospital. It has reduced hospital admissions dramatically. There is some evidence that it's beginning to stop transmission of the virus, and over 600,000 first doses of the vaccine have now been administered in Hertfordshire. I had mine a few weeks ago. They got to my age group quicker than I thought they would. And I had the AstraZeneca vaccine, and I'm looking forward to my second dose of the AstraZeneca vaccine. So the vaccine is a real game changer, but we still need to do a number of other things. The first is we need to be ready to open and trade with confidence. And that's about hygiene. It's about the kind of key safety measures that are in the guidance. The second is the opportunity to use testing appropriately, and that's what we're going to focus on this morning. We'll be having more webinars for you on things like vaccination. The third is managing outbreaks. So we have put more people and more money into COVID marshals to ensure people social distance in public places. And if you want them patrolling your high street to help your business, we can do that. And we'll put more in if we need to. We have outbreak teams of environmental health officers and infection control nurses there to advise you. So if you need advice for your business, please come and talk to us. We want to help you. And we're doing a range of other things. We will ensure that the elections on the 6th of May are safe. We have ensured that infections in schools have come down. So we are committed to ensuring that Hertfordshire can be open for business safely. And actually, we've got some great places in Hertfordshire. We're about to launch an accreditation scheme for safer retail, which is a national pilot that government likes. I want to say to you that some of our leisure facilities in Hertfordshire managed to go for several months without a single infection because of their commitment to safety. So if any county can open and trade safely, we can. And what you need us to do to help you, we will do our level best to deliver. So that's a promise from me. The next few months will be a bit volatile. We are in a kind of a race between the vaccine and new variants. The risk every time somebody gets infected with COVID is that the virus gets a lottery ticket to develop a new variant that will escape the vaccine. And if you're really bored, there's a blog on a thing called the Healthcare Infection Society by me about new variants that will have you asleep in seconds. So that's the risk. So the fewer infections we have, the more likely the vaccine will be able to do its job. The good news is that actually our infections are as low as they were last September. That's really good news. I aim to keep it at that level. So having you tell us what you think we need to do for you, but also at the same time doing our bit and working together to prove that we can trade safely is a key thing going forward. So the role of testing is quite important in that. And you'll have heard the government's announcements that there's been changes to the testing system from today. The government's introduced abilities for businesses to get testing. And what I'd like to do now is hand over to my colleague Susan Hamilton, who's one of our consultants in public health, and she's our system testing lead. We have a bit of a testing industry going on in Hertfordshire, thousands of tests a week from social care and NHS right through to members of the public in businesses and school settings. And Susan's going to take you through where testing could help for you and your business and what to do about it. So without further ado, if I may, I'll pass on to Susan. I've got to be kind to her because she has to put up with me. So Susan, over to you.
Thanks, Jim, and it's a pleasure to put up with you, Jim. Really pleased to be here and to have this opportunity to speak to you all. So I just wanted to just give you a bit of overview of testing generally and some of the sort of policy changes that we've seen over recent months and where we are today. And then just outline what the options that you've got as businesses to support us with testing. As Jim said, you know, this is a really important strand of being able for us to be able to open safely. And it really, you know, we're really interested in how we can continue to support you as businesses. So please do ask the questions and please do put suggestions that we can take away and continue to work with you on. So I'm just going to just share my screen. I've got a few slides. Okay, can everybody see that? Yeah, brilliant. Okay, thanks. Okay, so just want to first of all sort of go back to what are the tests available. So throughout the COVID pandemic, testing has been really important, and there are two types of tests that we use, and we use them in different ways. So the first one, we use both what we call rapid tests, or we call them lateral flow tests, and the other one are PCR tests. So I just want to sort of illustrate what they are and what the difference is. The rapid tests, or the lateral flow tests, are the tests we use for people who don't have symptoms. The reason why, and there's been a sort of rapid expansion of use of these tests, which I'll come on to later, but the reason that these are important is because of the number of people who are carrying COVID or infected with COVID but don't have any symptoms. So it's estimated that we've got about 1 in 3 people who fall into that category. And this is a really good way of picking up those people early in the infection and spreading transmission. The other benefit with them is they're very quick and easy to use. I'm sure quite a lot of people on this call will have experience of them, but it's like in effect doing a pregnancy test. You can do them at home or in the workplace, and they're very quick. So you typically get results within 30 minutes. So, the other type of test, just to distinguish it, is the PCR test. So the PCR test is it's what we call the gold standard. So it is more accurate than the lateral flow test, and also can detect, as Jim was talking about, the variants of concern, which are increasingly important to us, and we need to really focus on reducing transmission of those and emerging new variants. But they do take longer, so you do need to process them in a lab. So typically you can get that you need about a day to turn around, and you need to send them off. But they are they are useful, really useful both. And so we prioritize those used for people with symptoms, also to confirm the results of rapid tests, and come on to that in a bit. And they're also routinely used for some workforces, particularly NHS and social care. And you can get them either ordered online or by visiting a test site. So just in terms of sort of the nuts and bolts of what happens when you get tested, all results, be it rapid tests or PCR tests, need to get logged with the NHS track and trace. Anybody that has a positive rapid test, the lateral flow test, now needs to go and get a PCR test. So the one that needs to get sent off to the lab. You need to do that within 48 hours. And what that means is that what happens then is that triggers the national track and trace system to start contacting, to contact the person who's infected, to get them to self-isolate immediately, and also to quickly identify their contacts. So the positive test triggers the legal requirement for the self-isolation, and also access to support, including financial support. So that's what happens when you log results. Just in terms of a bit of context on testing policy, so at the start of the pandemic, only PCR tests were available, and they were focused initially in hospital settings, care settings, and then expanded. But really, throughout the last sort of few months before Christmas and onwards, we've had a really rapid expansion of the lateral flow test, the rapid tests. And as of today, as Jim mentioned, these are now being made available to all adults in the country, and through schools and other educational settings, children for year 7 and above. And with the encouragement that everybody should be testing regularly, with the recommended testing schedule of twice a week, a few days, at least 3 days apart, 3 to 4 days apart. So the policies changed quite a bit over the few months. Initially, it was focused on NHS and social care in terms of rapid testing. So before Christmas, there was an expansion of use of tests in those sectors. Then early January, schools got rapid tests, as expanded to the education sector, and there were pilots in certain workplaces, particularly large workplaces, both public and private sector. Middle of January, local authorities were asked to establish community testing programs, which we did. So we've got rapid testing sites across Hertfordshire, and then more recently, the government's introduced home testing available to the wider population. Initially, it was targeted at parents of school-age children, and as of today, anybody can access these, and with online ordering as an option. So that's just a bit of an overview of where testing, the sort of landscape of testing, and the different types of tests. So if we come on to what businesses, how businesses can support testing. So I think there's sort of three ways whereby where you have a key role or options for supporting testing. The first one is to set up your business as a testing site. So you're testing your workforce in the workplace. There's been a DHSC scheme, a sort of national government scheme running to support that for the last few months. And we also know that there's increasing private provision and private sector providers who can come in and support organisations to do that. The second one, which is quite a recent option with the expansion of home test kits, is a government scheme called Workplace Collect, where workplaces can order home test kits to be delivered to the workplace to give out to your staff. And the third one, which I know you've been doing, and it's an option to continue, and we encourage you to continue to do, is signposting to the other testing options available. The key thing, as Jim was saying, is this is a really key part of us being able to open up and trade with confidence. It provides confidence both the workers and the customers. It helps keep businesses open, and ultimately it reduces transmission, and it really helps keep the infection levels low, and particularly in this crucial period where we're sort of rolling out vaccines. It's really important that we keep the testing levels up, and that, as part of that, to keep transmission infection levels low. I'll just move on to sort of some of those, a bit more detail on some of those options. So in terms of on-site testing, I know a lot of businesses or workplaces in Hertfordshire have signed up for the DHSC scheme, and really pleased to see that. So I think we have about 500 signed up. I think the DHSC last figures were saying, which is brilliant. So in terms of that scheme is still open till the 12th of April. And what that scheme does is provide you with free test kits and helps you set up testing in the workplace. So it takes you through the steps that you need to enable that to happen, both in terms of training your staff, getting the kits ordered, getting the area set up. It doesn't need to be very complicated, but just understanding, how you what equipment you need and how you set things up safely and process the test results. Employee engagement is a key part of it to get high uptake and encourage continued testing, and then processing the samples and sending up the notification results. So this has been really popular. As I say, it's still open till the 12th of April. So it's still an opportunity for businesses of any size to be able to sign up and establish testing on site. So that's the DHSC scheme. It's really targeted for businesses where you've got people coming in to the workplace, and as I say, it's always responsibility to you collect the results and you submit them. Increasingly, we're aware of private companies, and the government's aware of private companies providing that service. And the government has, on the government website, actually, there's a list of companies that the government has sort of made available to that actually meet the standards required for workplace testing. So if you don't want to run it yourself and you want to get a company in to do it, I'd encourage you to look on the website, government website, at those list of companies. So it gives you some assurance as to the standard of provision and support that you're getting. The other option that has just become available in the last couple of weeks and will be available till the 12th of April is what they call Workplace Collect. So this is where businesses can order home test kits to the workplace to give out to your employees. So it's for organisations with 10 or more employees. And you get those boxes, that NHS test kit boxes, for employees to go home and take the test. So the responsibility of the employers is just to distribute the test. It is up to the employees to report the results directly to the NHS Track and Trace, and to ensure that that happens both for negative and positive results. So it's quick, it's convenient. It just makes sure that you've got your employees can have access, have easy access to tests if home testing is the most suitable option for your business and for your employees. The other option that I know a lot of you are currently doing and can consider urge you to keep doing is just to signpost to other testing options. Over the last few months, there's been a rapid expansion in where people can get home tests, and over the last few weeks, a big expansion in where home test kits can be get home test kits. So I've sort of listed them there. There's a government portal you can go on, and you can just order online, and you get a box of tests that lasts you several weeks. It's very quick and easy to do, and I think most people get it delivered within a day or two of putting the order in. Just established this week actually is community pharmacies, and you can get just put the and that's in addition. So these are community pharmacies where you can go in and pick up home test kits. There are also community testing sites where across Hertfordshire where you can drive up or walk in and pick up boxes of home test kits. And there's an online portal on the gov.uk site which shows you the location, shows you the opening hours, and I've just put a little sort of screenshot there. And you can click on the sort of interactive map to find out where those are. So those are the options for getting a home test kit. So it's becoming much easier for individuals to access their own testing. As I mentioned earlier, that as a council, we have established a programme of community testing across the county, and we've had sort of between 8,000 and 9,000 people coming, certainly for the first couple of months. Each week for the first couple of months. So it has been really popular. So particularly for those workers, we've targeted at key workers and essential workers who had to continue going out during lockdown. Criteria is open. Anybody can any adult can access over the age of 16, and there you can get the test. It's an assisted test site, so there's staff on the site to be able to help people with the test and processing it and loading it up to the government website. So we're continuing to run those, and if you go onto our website, you can find out where those are. We've got locations changing every couple of days to make sure we've got a spread across the county. So that's still very much an option for people who don't want to do their own tests at home. So those are the sort of numbers of options available for home testing, just talking to business and organisations across Hertfordshire who've been doing this for a while. I just wanted to sort of pull out some lessons learnt or areas to consider to encourage high levels of testing within the workplace. And particularly if you're opting to sort of use home testing as you're encouraging your staff to do home testing. It's really important as employers, or you could provide a really key role in encouraging sort of ongoing levels of testing and throughout the weeks and the months as we go on. So this is just a few sort of lessons learned, and I'd be interested also in feedback from you as to what's worked for your organisations or areas that we collectively can focus on. So where it's worked well and you've got high levels of testing, we've seen that actually we've got really clear leadership commitments. So the executive team, the top team, are sort of visibly encouraging staff to test, reinforcing the importance of it. And the importance of in terms of wider transmission and keeping businesses open and keeping confidence high. So methods that other organisations have used include staff briefings, Q&As, leaflets, etc. Making sure it's tabled in your sort of key meetings, and that your employees know that it's top of mind. The other thing that's been really important is positive communications, or sort of ongoing communications campaign. So really reinforcing those sort of positive messages, the rationale why it's important, and encouraging uptake. So some examples of measures that people have used are, put your stickers on the box saying twice a week, support business, support the community. Some organizations are sending out text reminders on the days that, they're encouraging people to test, messages popping up on the internet, that sort of thing. So it does require sort of a really strong internal comms that needs to sort of run continuously. The other area where people find it really, it's been really helpful, is actually getting staff to both report to the, everybody has to report their results to the NHS track and trace, but also dual reporting. So you're reporting to the organisation as well that you've tested and what the results are, because that can really help monitor levels of testing in the organisation, where you've got low levels of testing and there may be some additional support that's required, or additionally where you've got sort of high levels of testing and actually you want to celebrate success. So some organisations have sort of organised, I don't know, a bacon butty day or whatever to really sort of celebrate and encourage those high levels of testing, and celebrate where teams are really committed to regular testing. As part of that, organisations have sort of developed interactive live monitoring and made those results widely available, and reviewed them regularly to identify actions and focus on areas that need additional support. And just the last sort of couple of things where ideas or examples of where interventions have worked is that direct support from team managers and team leaders can make a real difference in terms of making sure that the team's regularly discussing it. It's a sort of business as usual. We've had examples of people starting their shifts, a team leader starting their shift going, has everybody tested? Any issues with testing or getting tests or tests available? And where needed, actually supporting individuals. It may be that they're struggling to log the results or they need a bit of additional support. So that sort of individual team support and individual support can make a huge difference. The other aspect from sort of managers is just making sure that we realize that testing is really important, but it's just one component of a range of things that we need to keep doing. So the other preventative measures in terms of social distancing, face cleaning, all the other stuff that, all the other measures that you're doing. It's not a magic bullet, and the rapid tests don't pick up all cases. They pick up a lot, and it's really important. They don't, so you need to make sure that you're maintaining all of those other preventative measures, and making sure that that when staff are symptomatic, they are going for the PCR test. And they're encouraging to do that and to self-isolate. And the last one I just wanted to highlight was just encouraging reporting, particularly if people are doing it at home. We can only act if we know, and we can only act, and the quicker we know, the quicker we can act to prevent the spread. So, the quicker that staff can report the test to the NHS, and it means that we can identify, get in touch early to make sure that they're self-isolating, and that we can identify the contacts quickly and get them to self-isolate. Speed is of the essence, and it really helps to stop and to reduce the spread of transmission in the workplace and in communities. It also means that that as employers, you can quickly identify where you've got, you may potentially have a workplace outbreak, and we can work with you to make sure that we're addressing that as quickly as possible and preventing transmission. So I'll stop there, and hope that's been useful in terms of a bit of an overview.
Thank you, Susan. Thank you, Jim. Absolutely comprehensive, straight to the point and straight talking. Couldn't ask for it to be in plainer English. So thank you very, very much. We have got a couple of questions, and rather than me just read these out, I'm going to ask the individuals who put the question up there if they wouldn't mind asking the question, because it gives a little bit more of woman interaction. So Julie Forster, would you mind coming off mute, putting your camera on and asking your question to our experts, please?
Thank you very much. Yeah, my question, I'm the corporate safety manager at the Royal Veterinary College. So we have a lot of employees and a lot of students on the Hertfordshire campus. And we've currently provided them with private tests for testing. And I just wondered whether, my question was whether the Workplace Collect scheme would apply to students as well as the employees. I have registered for this, but to date, I haven't had any response yet from the government portal.
Thanks, Julie. The Workplace Collect is predominantly for staff, but we can raise it through the data. The answer is I don't know in terms of the students eligible. Students can go out now that tests are freely available. There's a range of options for them to access their own tests, and so I'd encourage you to promote those. In terms of getting tests specifically to your organisations to hand out to students, I think we need to take that away, ask our DHSC colleagues, and I'll come back to you with an answer. So appreciate that. It's great that you've signed up, but we'll use our channels to try and progress this.
Thank you, Susan.
Jim,
if I can just add to what Susan's saying, I mean, I agree, we'll take it away. There is a universities cell working, and I know that the University of Hertfordshire is part of it, and I know, Susan, that your outbreak plan was part of it because we worked to sign it off, and it's a very good outbreak plan. So if the cell can help as well with measures, then I guess come and talk. I think what Susan's saying is come and talk to us to help.
Lovely.
Sure.
Thank you, Jim.
Thank you.
Thank you, Julie. And we'll put you all in direct contact. So I'm going to come to Crystal now. Hello, Crystal. If you could put your camera on, that would be lovely. And please ask your question. I'm trying to find you on the screen.
Yeah.
There you are.
Thanks. Yeah, we've been discussing at our workplace sort of testing using the collect option, but I know there's been a few people voicing concerns about the data that's required by the NHS track and trace, because none of us have done it ourselves yet. So I was just wondering what kind of information it is that they request, just so we can inform our staff.
yeah, so with the home collect, yeah, it's up to the individual to enter the test result. It's fairly straightforward. I've done it for a few weeks. I've got children at home, so I'm getting used to it. The test results. So it's contact information. It's a bit of demographic information, and then your test result. It doesn't take very long. It goes straight into the NHS, so it's held confidentially within the NHS track and trace system. So it's used for those purposes to identify positive cases and contacts they're ongoing. In terms of the requirement of the business, you're not required as a business through Workplace Collect to submit any information. You're literally disseminating out the home test kits. We can provide screenshots if it's helpful for your staff to sort of walk through the process, but it really is sort of basic contact information, a few demographics, and your test results. So once you've done it once, it's really quite quick and easy to do.
Okay, so is the information, all of it, there's more information to register the first time, but then after that, is it less information required because it's already in the system?
I don't think there's, I haven't found a way of, yeah, I haven't personally found a way of storing that, but it really doesn't take very long. It's really quite quick.
Okay.
So you know, it's a couple of minutes twice a week, is what I find.
Okay.
So yeah. Okay.
Thank you.
Jim, have you got anything you'd like to add to that one?
The only thing is that we are working with government to try and get them to kind of make it as easy as possible in terms of the portal, because gov.uk, it's not always the easiest website in the world to navigate, is it? But they are making it. This is surprisingly quick in terms of the information.
Yeah, as I think we've just got some staff who are maybe not, you know, they're not IT, you know, great IT skills, so it's a concern to them, and it's sort of like just another thing which is maybe putting some members of staff off doing the test, is doing the online.
Yeah, and I think, sorry, I didn't mean to interrupt you, that the worst you could do is freeze the web page. But the security protocols, if I had to say to you that there are 6 different levels of security, certainly to get access to the testing and contact tracing data, and it's a very small number of named individuals who can access it for contact tracing. They are very tight on this because it is medical data, and the gov.uk website is very secure. So it is just a case of learning how to do it. I mean, show my neighbour while standing 6 feet away and using an iPad, and we managed that. But practice makes perfect.
Yeah.
As Susan says, it's not that difficult.
Okay.
Yeah, I mean, just you know, I was talking about sort of lessons learned from other organisations. So that has been a concern in other organisations, and what's been helpful is where you've got somebody to actually just walk them through it once. And once you've done it once, as you say, it just becomes you get the confidence, they know what they're doing, and actually for most computers, it'll store your your details and just automatically. So it is quick and easy, but if I'd encourage you to if you could have a buddy system to help people that first time, it could just get over that initial challenge.
Yeah. Okay. Thank you.
Lovely. Thank you, Crystal. And I love the comment, Jim. I never thought I'd be standing over a hedge 6 feet away showing my neighbour how to do it on an iPad, and she's a pharmacist. That was fun. Well, another great question's come along, and I'm actually interested to know this one because we were running events. Everything's on Zoom, as we know. So Claire Fernall Williams, hello there. Could you ask your question, please?
Yeah, hi Breege. I run Hemel Hempstead Business Ambassadors, and we are a suddenly noise. We're a business networking organisation. We run events much as the Hearts Chamber do, but for businesses in decorum. Now, my question really comes about thinking we're going to be going back to live events in July. We've announced our first face-to-face meeting. What are my requirements or my rights to ask our members? We could have 75, 100 people in a room at that July event. Obviously, this will be after the lockdown has eased totally. What are my requirements to either ask my members to take a lateral flow test, to register that they have taken one through their workplace? Obviously, as an organisation that sits as part of West Herts College, we can't as a business register to have the testing, but it would be really interesting to me to know how I stand to ask my members to sort of almost provide this COVID passport we're hearing about.
Susan, do you want me to try on that one? The short answer is the government is currently reviewing what it's calling certification, which is a whole kind of issue of vaccination passports in language and testing passports. And the short answer is that businesses are within their rights already to require people to use testing as a condition to go into events under the law. At least that's my reading of it. And businesses, and there is some employment law around vaccines as well. And in fact, there was a legal webinar from the Society of Local Government Lawyers, and you know, whose parties are a hoot, I'll bet. And I'll just post the link into that in the chat. So currently, the government hasn't regulated this, so you can do this and you can require it. My advice would be to speak to either your local, to Decorum Environmental Health, or come through to one of our infection control nurses, who will advise you on the kind of package of things that need to go along with that. So it's not just lateral flow testing you would want as a kind of test to enable test release, but it would be things like the hygiene measures and the signing up for track and trace and various other things. Now I'm going to ask Susan if I've got that right, if I've completely met the testing thing, because that's my reading of the law currently.
No, I think that is right, Jim. Yeah, as we open up, yeah, we'll have to develop standard ways of doing this, but it is a package of measures. So yeah, so Jim, you're absolutely right on that.
So I wouldn't rely on testing alone. I would bear in mind that at some point, so for events, they certainly have a value. You'll probably know that we're about to have these national pilot events, including things in Liverpool that will use testing as part of that, but they'll still use hygiene and face coverings and social distancing and all the rest of it, because the biggest risk is you breathe in the infected aerosol of another person. That's the biggest risk. And that's what we want to avoid. And if you think of a series of barriers, we often talk of a Swiss cheese defense, which is testing plus self-isolation plus face coverings plus hand hygiene, especially if you kind of infectious droplets onto your hands. All those together will stop the virus, but don't rely on any single one just in itself, if that makes sense. So we can give you free advice on a kind of bespoke package that works for you.
Lovely, thanks, Jim. That's a really good point, Claire. Thanks for raising it, because we're in the same boat. But we've also got Lauren Dovey on, and you might have missed the webinar yesterday, but she is from Better Business for All, which is also part of the County Council, covers trading standards, environmental health. And so we recorded her webinar yesterday. We've got more webinars coming up. So we're interested as much as you are. So stay with us on our series of webinars, because things are always changing. So I'm going to come to Jax Claydon, who's asked a question. Where are you, Jax? There you are. Lovely. Would you like to come off mute and ask your question, please?
Yeah, we've been working from home for roughly 14 months. And in our staff meeting on Thursday, a member of staff raised that they weren't comfortable going back into the office, even on a phased approach, which was our plan, unless everyone had taken the vaccine. Now, we can't make people take the vaccine, that's their right, but can we make them test to get other staff to feel comfortable that they've had their test, at least, if they're not willing to have the vaccine or prove that they've had the vaccine?
I think this is one where you need some good employment law advice. And if I need to commission it on your behalf and pay for it from the Contain Fund, then I'm quite happy to do so. There is an article in this month's People Management magazine, which is the magazine of the Chartered Institute of Personnel and Development. So if there are any personnel or HR people out there who want to work on this, can I suggest maybe we bring the Hertfordshire HR community together to look at it? The short answer is that there is legal opinion that you can require people to test to come in under employment contract law, but again, you run the risk of equality law challenges for those people who either can't, or for medical reasons, or for equality reasons, can't or won't test. You also need to prove that that is a proportionate measure. So your underlying duty under the Health and Safety at Work Act, there's a dual duty. So there's a duty on you as an employer to put in place the measures for people to be safe. And there is a duty on the employee to take those up and to do everything they can. And it applies to customers as well. So supermarkets do have a duty to keep their customers safe. And some supermarkets do a very good job, and some, I think, need to do a little bit of a better job. So I would say that the key thing to do is start your risk assessment and look at the measures to make it safe and build confidence. And testing in and of itself is not a magic bullet, neither is vaccination in and of itself. And there will be a number of people in your workplace who for medical reasons cannot be vaccinated. And that's the whole basis of herd immunity, is that those of us who can be vaccinated get vaccinated so that so that those who can't are protected by us, because the virus can't get to them. So if I were doing it personally, I would I would go down the encouragement route, which is explain to people what it is, explain to people the different measures, explain to people the balance of vaccination and the fact that vaccination is, lovely. So we've had an HR manager post something in the chat. That's fabulous. It's always good when that happens. Explain to people that the vaccination is not a magic bullet. It's really important. Testing is not a magic bullet. It's that kind of package. And together those things come, because actually all you need is someone to bypass the hygiene because they think the vaccine's here and you've got an outbreak on your hands. Now, if needs be, we'll quite happily sit on webinars, you know, that if the Chamber wants to organise them with Lauren and company, we'll quite happily sit and do this kind of thing with employees present and managers present and answer these kinds of questions. But I think you're better taking a combination strategy of encouraging vaccination, thinking very carefully with HR colleagues about testing, and then putting in place a sort of risk assessment with hygiene and all the other measures. And if you are going to go down, and this is where I bow to my HR colleagues, if you are going to go down the line of contractually requiring vaccines, bear in mind that, you know, that there are the risk of detriment in employment law under the Employment Relations Act and a number of other things. So this isn't straightforward. And I think what we'd like you to do is we'd like to help you put in place a package that works rather than a package that might see you in an employment tribunal. Does that help?
Right, thank you, Jim. Great question, Jax. I'm going to come to one of our own team now. Alison, you have a question, a very important question.
Thanks, Briege. Yes, it's just around when we do start to run our own face-to-face events again, where does the responsibility lie for the testing? Is it with ourselves or is it with the venue?
Oh, that's stumped.
I think it would depend on what type of event it was. If you were organising it as you're, I mean, this is a weird one because you could say it's a shared responsibility. I know that some venues are putting in place a requirement on others to use the testing. My advice would be to discuss it with the venue. What you could do is you could say that you want people to test before they come in to the event and access one of the routes that Susan has gone through. If it's any help, and I don't know how I know this, and you probably all realise that I'm deeply sad and don't get out enough anyway, but there are a number of insurance companies who are currently writing guides for venue hirers. So there's no legal obligation on the venue hirer, but there may be an obligation on but they do have an obligation to keep the venue safe. You have an obligation to keep the event safe. It's where testing fits into that. And if you want to do testing, it's then work out which route you go down with testing. But these things are being piloted at the minute, and they're in sort of national government's hands. So I think the best thing we can do is find you by using that advice of giving you a way of boxing and coxing your way through this. Does that help? I'm sorry that's not an exact answer, because actually nobody nationally has thought about it clearly.
And I think, Jim, because it is our event, it's our responsibility as we stand at the moment. That's my view. Better to do belt and braces. If we're putting on an event, don't rely on somebody else to do the work. I've always said, if you want a job well done, do it yourself. So we'll do it ourselves until we're told otherwise. Okay, I'm just looking to see if there's any other questions. So lots of chat going on about other events, because we are running other events, which I'll come to. But before I do that, may I ask Susan, the screenshots that you mentioned earlier, is there any chance you could send them to the chamber so that we can put them on our website?
Absolutely, yeah.
Package? That would be great. Are there any other questions? While I've got you all here, if anybody wants to ask a question, we will be running other webinars around these subjects going forward. And we will be sharing the slides, and we will be sharing the recording of today's and yesterday's, which covers some of the questions in more detail, like employment law. And we're going to continue with this. As your questions come through, we know then what you need to know, rather than us just putting something on guessing. So the more information you give us and the public health team and the trading standards team and environmental team, the better we will be able to have the experts on to give you direct information. So we have got a couple of other webinars before we finish, in case somebody does think of a question before we go. On the 23rd of April at 2:30, we have got everything you need to know about vaccinations, again with Jim and his colleagues, and I assume Susan might be involved in that, but I'm not going to put her name to it just in case. And then on the 13th of May at 3 p.m, we have a webinar on trading safely and trading confidently. And it's the second webinar to the one that we did yesterday. So you can catch up on the recording of the first one. And it's preparing your business for reopening. So it's basically the step 3 in the roadmap. And that's with Lauren Dovey, who I can see some of you chatting to her, and her Better for Business for All team, which will uncover trading standards, environmental health, fire and safety, everybody that you would need from the county. This is all free advice. This is all free. Don't need to go to anybody else, but go to your county council, because they've got all the experts there. And then on the 20th of May at 11 o'clock, we have staff safety and well-being. And that's going to have Lauren's team again, the Hearts Growth Hub, and lawyers on there, so that you can ask any of these questions about the the legal implications of the things that we're saying. But I have a question for our experts, and this is a crystal ball question, so I don't suppose you'll be able to give me a definitive answer. How long do you think we will be testing the population with around COVID? Is it years, months? Do you think it's going to go on for indefinitely?
So I think this virus is not immediately eradicable. So we're not going to get to zero COVID this year. And I think there are probably 3 scenarios. Scenario 1 is that it mutates to a much milder form of disease and becomes manageable in the same way that we manage other diseases. Biologically, that's looking likely. Scenario 2 is that it mutates into ever worse versions, like the Brazilian version, which as likely across the world, despite the awful tragedy that's going on in Brazil. And scenario 3 is it just fizzles out and disappears a bit like SARS-1, which I don't think is that plausible, but it is possible. So I suspect for the next year, we will be tweaking vaccines because of new variants if everybody really focuses on smashing this virus and its transmission, we will, I think scenario one is biologically more plausible. If not, we will end up with variants, and we will end up with tweaking vaccines, and we'll end up with sporadic outbreaks. In terms of mass public testing, I think it will probably be something that will persist for a month or two, and then it will become embedded as a habit for people who really need to do it because of the nature of their work, working in social groups. That's my crystal ball gazing, but you know, it's and bear in mind that the dominant form of the virus now in Hertfordshire and all of England is the Kent variant, which is much more transmissible and causes slightly worse disease, and people are in hospital for longer with it than the original variant. So that variant is going to stay dominant until a variant like the South African one knocks it out the park, which I don't think is going to happen anytime soon. But the big issue is the variants. I mean, I don't know if Susan, what Susan thinks. That's my.
Yeah, no, I agree. I think the nature of testing will change over time. I think we're going to have intensive testing over the next few months, and certainly the national policy just covers the next few months. But it will be an important part of us going forward, but much more it will be targeted at those high-risk groups, workplaces, etc., in line with the epidemiology. So it depends on, as Jim says, on how things change over time. We're assuming that you know we have to be adaptable, and we're going to have to flex accordingly. And that's going to be the key to it. But we're in for it is a long-term. We'll have testing long-term until that's what we're assuming.
So I think it's what we're really saying here is that it's really important for businesses and individuals, communities to embrace the testing, get over the fear of it or the lack of knowledge, actually embrace it, because the quicker that we do, the likelihood that it will reduce the amount that we'll have to do it in the longer term. So it's to get on it now to protect everybody and actually make your business safe. And give you the confidence to say, yeah, we're all tested. We're testing regularly. So yeah, no, that's great to hear. And I didn't think you were going to say it's a few weeks. I was sure it was going to be longer, but we'll just have to see how things go. But if everybody embraces it, it will make things easier for all. So I'd like to thank Jim and Susan. It's been fascinating. And what I love about it is that, you know, we've got a professor on this call, but he's so charming and actually very humorous that it's not like having, you know, somebody from University Challenge that we're talking to. He speaks a lot of sense and he speaks it so plainly, and the same for Susan. And we have Lauren on the call. She hasn't got her camera on. And as I said, here we go. Hi, Lauren. So Lauren and her team, and Jim and Susan and their team, we're running a series. Please look out on our website. We'll be on Heart FM radio advertising this. We are on social media. Spread the word. If you think this has done something for you today and you know a business, you're going into a corner shop, you're going to get your hair done next week, tell them to come on and join. It's free. It's free advice. You don't have to pay anybody to tell you what you can find out from our own county council, because here we have the experts. So I'd like to thank our speakers, and Lauren, we'll be with you on the 23rd again, I think. Yes. Lauren we'll put Lauren's team's details in the message that we send out. Lauren, just quickly give us a quick overview of what your team can do. Tell us the names of the departments.
Yeah, sure. So the Breeze already mentioned the next two webinars we're doing. So really what I focus on is working with local authority regulators, so environmental health, trading standards, fire safety, licensing. The main ones at the moment that businesses are needing support from is environmental health in terms of trading safely, your risk assessments. They're the ones that can help with all of that. They are there to help you. As Breeze said, it is all free advice. They're extremely busy, but do contact them and they will, they'll get back to you and have a conversation with you when they can. What I would say is if you have any problems getting in touch with the District Borough Council or have a question you're just not getting an answer to, then feel free to contact me, because I do liaise with all 10 District Borough Councils as well as county councils. So you can share my contact details as well.
Lovely. Thanks, Lauren. We're all in it together and we're all here to help each other. So, you know, spread the word, please, because it's really hard to get to every business and to every person in the county. But if we all think of it as contacting 5 people that we know to say, please come and learn, then it's going to get the word round and make us all safer in the long run. So with that, I'm going to say goodbye and wish you all a very safe and happy weekend. And thank you again to our experts, and thank you all for joining us and taking on board all the important information, and to the team for putting this on today as well. Thank you, everyone. Bye-bye.